Welcome to the Cystic Fibrosis Foundation's virtual patient education day, Navigating the Hills and Valley of CF Lung Disease, a webcast supported through an unrestricted educational grant from Genentech. I'm Leslie Hazel, Director of Patient Resources at the Cystic Fibrosis Foundation. This webcast will explore ways that people with CF, families and friends, can maintain healthy lungs, the importance of regular CF clinic visits, how you can partner with your CF care center to identify a pulmonary exacerbation early, and learn how it is treated. If you have specific questions about maintaining healthy lungs, please type it into the lower left-hand corner of your webcast window. However, questions not related to this topic or that ask for medical advice will not be asked or answered. To learn about nutrition in CF, quality improvements in CF care, building life skills to manage CF, the latest in research, patient advocacies, issues and answers related to insurance and government programs, and how to avoid germs, please watch an archived webcast on the CF Foundation's website. As with the other webcasts, this one will also be watching. Our presenters tonight are from Akron Children's Hospital in Akron, Ohio. Betsy Bryson is the pediatric nurse practitioner at the CF Care Center. Dr. Nathan Kranak is the director of the CF Foundation Accredited Care Center at Akron Children's Hospital. And Chris Singh is the coordinator as well as the adult nurse practitioner for the CF Care Center. I'd like to start out tonight with a question that we got in registration. And somebody wanted to know, what can they do to keep their child's lungs as healthy as possible?
Leslie, it's important that everyone is involved in maintaining healthy lungs. It's the responsibility of the person with cystic fibrosis, the parents, the family, and the healthcare team. What's also important is that you find a care plan in your cystic fibrosis that will work for both you and your child. It's important to work with your CF center in a plan of care that's both individualized and that will fit your needs. You should also make sure to do the recommended treatments, to exercise regularly, and to do a nutritional plan that is guided by your CF center. Also, it's important to do routine visits to your cystic fibrosis center on a quarterly basis every 3 months or more often if your child is sick. And by all means, it's important to avoid tobacco smoke, even secondhand smoke.
It's always good to avoid tobacco smoke, whether or not you have CF. Somebody else asked, what are the best ways to go about preventing infections in children with CF? And they were specifically concerned about the age group of less than 1 year of age.
You know, Leslie, that's often a question we get asked, especially of families that have a newly diagnosed child. They want to know how they best can do that. And what I say to them is that it's the same that you would do for any child that even doesn't have cystic fibrosis. And the number one thing that you can talk about is how to avoid germs. It's important, as you can see on your slide here, that there is a pamphlet put out by the Cystic Fibrosis Foundation, and you can get a copy of that from your CF center or from the CFF website. Now, what I want to talk about first is the most important thing you can do to prevent the spread of germs. You should use alcohol-based hand gels, or also called hand sanitizers, or wash your hands with soap and water. And how do people know which one to use? They both are effective unless you see dirt on your hands, and then you should use soap and water. It's especially important to clean your hands after coughing, sneezing, blowing your nose, or you do your respiratory treatments or airway clearance. Also, to maintain healthy lungs, the other things that you can do is minimize contact with people who are ill. You often may feel that you are fearful that you should not take your child out because they may get an infection, but you should let your child be like all other kids, except maybe during the height of the respiratory season, which is often the winter. You would not want them around big groups of people, such as in daycares or child nurseries whenever possible. And finally, you should minimize contact with other people with CF and educate others how they can help you stop the spread of germs with your child.
So somebody asked, is there a proper cleaning technique for nebulizers, and what is it?
There is a proper technique for nebulizers. And again, this is in Stopping the Spread of Germs pamphlet of how to disinfect items that touch the mucus or the nose by one of the following methods. First, you can boil for 5 minutes, or you can use a microwave for 5 minutes, or if your dishwasher has a temperature of 158 degrees water, you can use that for 30 minutes. There's also ways that you can disinfect by soaking them in one of the following solutions. 1 to 50 part, 1 part bleach and 50 part household bleach for 3 minutes. You can use 70% rubbing alcohol for 5 minutes, or you can soak it in 3% hydrogen peroxide for 30 minutes. With any of these methods, though, it's important to rinse with sterile water, and you should always air dry your equipment. Also remember that vinegar is not effective with respiratory equipment, and that is because the bacteria that CF patients have will not be killed by vinegar. How to avoid germs can be again looked at on an archived webcast on the CFF website.
So we talked about infection control, a little bit different tact. What is the responsibility for somebody with cystic fibrosis? What's their responsibility for their health care?
You know, that's a good question. We really want people not only to take care of their CF health, which can be done by the CF Center, and the team will take care of those needs. But you also have many general health needs that you need to worry about. And those are things that you can do by seeing your primary care provider. And that may be a pediatrician, or if you're older, it could be a family care provider. It's important to get the routine immunizations of childhood diseases that are recommended by the CDC or the Center for Disease Control. And you should also, at your primary care provider, get routine screening for vision, for hearing, and they will also provide you with health education that is often not done at your CF Center for simple things like car seat safety, bike helmets, or how to prevent sports injuries.
Okay, so that's what the person with CF is responsible for. What's the responsibility of the CF Care Center for CF Health?
You know, we have responsibilities at the CF Center also, and it's really important for us to be able to work with you to come up with that individualized plan of care and to look at each patient individually and make that plan of care to fit their needs for their child or for that adult and also for their lifestyle. We should help identify what potential treatments are out there, including ones for chronic therapies, and help you understand to be able to make an informed decision if this is a potential therapy for you or your child. It's important also to monitor your CF health through clinic visits, through looking at lung functions, x-rays, and lab tests. Other things that we can do is it's very important for your CF Center to provide infection control to decrease the potential transmission of CF bacteria. We should also recommend what a flu vaccine is, and you can get those from your CF Center. Any person with a chronic respiratory disease, including cystic fibrosis, needs a flu vaccine, usually in the autumn season of the year. It is important that we help identify what community resources are out there, such as some social service agencies, scholarships that may be available, or other things, and help you initiate how they can work. It's important for us to educate you. We may educate families, and we also help educate daycare workers and schools about cystic fibrosis. And finally, one of the most important things we do is to treat you or your child when they're ill.
Okay, so that's all that you do, and the person with CF is taking care of their health. Why do they have to go to the CF clinic 3 times a year when they feel perfect, or 4 times a year when they feel perfectly fine? And why every 3 months and then more often when they're sick? That's a lot of time.
It is a lot of time, and many families ask us, my child feels really good. Or the teenager says, why am I having to use these medications or do this kind of stuff when I'm feeling so well and have to come to see your clinic, come to the clinic visit more often? Well, often with cystic fibrosis, there's some subtle or gradual changes that happen, and it's important for us to monitor those. Even though you may see some of these changes at home, there's other changes that we will notice by listening to your lungs, by measuring the pulmonary functions, by doing vital signs, looking at the oxygen level in your blood, and also by doing lab tests such as a sputum or throat culture to determine what type of bacteria are growing.
So how does someone with CF know that they're getting sick? What are the subtle changes that they may encounter?
Often they are subtle, like you said. It may be something as simple as, I feel tired or I'm more run down. What kind of things could be happening is that they're not able to keep up with their peers. They have difficulty in their gym class. or symptoms such as decreased appetite. They're just not eating as much, or they're skipping a meal, feeling tired, or have a fever. But often you'll see some respiratory symptoms. Their cough is just not at the baseline it used to be. It has increased, along with maybe being a little short of breath.
So what does somebody with CF or a parent do if they or their child is experiencing these symptoms?
You know, it's important for everyone to know what the protocol or the procedure for calling your cystic fibrosis center is, even if it's at night or on the weekend. How do you get a hold of someone? You want to give details about what kind of changes are happening with yourself or your child, such as what their breathing is like, what their appetite is, how their activity may have changed. Be honest and help your CF Center team members know what medications you're taking and are you able to follow the plan of care that was recommended. But most importantly, don't wait too long. It's better for you to call early with a question than to wait for a couple weeks when you've seen symptoms.
I encourage you to look at the CF Foundation website under the treatment section and click on therapies to learn about the different therapies used for CF lung health. Additionally, there's information about lung transplantation and CF nutrition. You can also learn about CF lung health and maintaining it in the Treating with Cystic Fibrosis section, Living with Cystic Fibrosis, the Staying Healthy section. There's information about germs, lung health, information about which nebulizer to use with which drug, as well as information about CF nutrition. This is also the section where you will find the archived patient education webcast, using nutrition to stay healthy with CF, quality CF care and how to raise the bar for CF, updates on CF research, building life skills to manage cystic fibrosis, patient and advocacy issues and answers related to insurance and government programs, as well as how to avoid germs. As with other webcasts, this one will also be archived. I also invite you to join us for our next webcast this fall for an update on the latest in CF clinical research. You can check the CF Foundation website for more information. We encourage you to partner with your CF Care Center and ask how you can maintain healthy lungs with cystic fibrosis. In conclusion, we would appreciate it if you would fill out the evaluation form and tell us what other topics you would like to hear in a virtual CF Education Day. I would like to thank you for watching and submitting your questions, Betsy, Nathan, and Chris for answering the questions, Akron Children's Hospital for hosting, Rick Vasta and the technical crew, Genentech for their unrestricted educational grant, and the Cystic Fibrosis Foundation for making this webcast possible. Thank you.